Picture a typical day in your life: waking up, going to work, coming home, and going back to bed. Now picture this day without the sense of touch. Imagine not being able to feel the bed you're laying on or the temperature of the water during your morning shower. Imagine hugging your loved ones goodnight, but you cannot feel their embrace. Like many of our senses, our sense of touch is one we don't think about often, although we rely on it for many of our daily activities. But what exactly does it mean to lose our sense of touch, and why is it so important? Loss of touch happens when the nerves in the peripheral nervous system are damaged. This is also called peripheral neuropathy, peripheral referring to the nervous system that is affected, and neuropathy referring to nerve damage. Damage to the nerves can affect one nerve, several nerves, or even all the nerves in the body. In most cases, many or most of the nerves in the peripheral nervous system are affected. Here are some of the causes of nerve damage: age, diabetes, Parkinson's disease, consuming too much alcohol, tumors developing on the nerves or pressing against the nerves, exposure to toxic chemicals and heavy metals such as lead and mercury, and the lack of vitamins B1, B6, B12, vitamin E, or niacin, which are important for healthy nerves. It is important to remember that nerve damage can be caused by more than one factor, and in some cases, there may not even be a known cause for this condition. The safest bet is to make sure that we have as few of these factors as possible to minimize our risk. While losing our sense of touch may be a normal part of the aging process, you should consult a doctor as soon as you notice the early signs of nerve damage, which may consist of unusual pain, tingling, or loss of sensation in the hands or feet, weakness, loss of balance, or a cut or wound on the foot that isn't healing. It is important to diagnose and treat this early, because the earlier the detection, the better the chance of controlling the symptoms and preventing further loss of touch. People with high risk of neuropathy, such as people with diabetes, should also go for regular checkups. Peripheral neuropathy can feel like stabbing, burning, or tingling pain, lack of coordination and falling, feeling as if you are wearing gloves or socks when you're not, problems with bowel movements, bladder, or digestive function. Lastly, dizziness or lightheadedness due to changes in blood pressure. These symptoms may develop over a period of days, weeks, or years, and may even sometimes improve on their own. However, there are also more serious consequences to peripheral neuropathy, such as burns and skin injury, as it will be difficult to feel changes in temperature or pain on the affected parts of the body. Infection, as the areas lacking sensation can be injured without you feeling it and may be left untreated. And lastly, higher risk of falls due to weakness and loss of sensation, which can affect balance. Oftentimes, you may not be able to feel body pain or changes in your body temperature. This means that you may have an illness or infection without knowing it and won't realize it until it has progressed very far. This can be dangerous, especially for older adults who have diabetes. There are few things in life that are truly out of our control, but this is not one of them. If you can't imagine yourself in a world without touch, then let's not take it for granted.